Okay, we have seen bacterial sexually transmitted infection. Now viral sexually transmitted infection. Genital herpes. Herpes simplex virus soars in and around the vulva or vagina. Urethra in females or soars on or around the penis in male. Female nuடைய vulva and vagina, urethra. Male nuடைய urethra and then in a penis. Pain during urination, bleeding between periods. So pain, they will feel very pain during the urination. Then sometimes for what? Bleeding also will occur. Swelling in the groin nodes. Their joint, that groins regions also. Groins then தொடக்கும் அந்த pelvic cavity க்கு நடுவுல உள்ள அந்த jointல இருக்கக்கூடிய அந்த place. That is known as the groin. So swelling in the groin nodes. These are the symptoms. 2 to 21 days. Average 6 days is the incubation period. Then genital rods. Then human papilloma virus. Hard outgrowths on the external genitalia, cervix and perianal region. Then that anal region. அதுக்கு முன்னாடி உள்ள perianal region, a small what outgrowth, tumorous, தேவையில்லாத ஒரு கட்டி மாதிரி ஒரு tissue growth it is present. External genitalia, cervix and perianal region. 1 to 8 months. Then hepatitis B. Hepatitis B virus. Fatigue, jaundice, fever, rash and stomach pain. Liver cirrhosis and liver failure occur in the later stage. So 30 to 80 days. Okay, so liver jaundice also it is caused by damage of liver. Fatigue, they will not feel what appetite, அவங்களுக்கு பசி எடுக்காது, ஒரு மாதிரி அப்படியே மந்தமா இருக்கும். Okay, then AIDS. So human immunodeficiency virus. Human immunodeficiency virus, positive agent HIV, enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction and night sweating. 2 to 6 weeks, even more than 10 years. This disease is incubation period. Can you understand these viral diseases? Genital herpes, genital rods, hepatitis B and AIDS. So bacterial disease we can have in a treatment, but viral disease no treatment. But with the help of the medication we can reduce the symptoms only. Okay. The next now we are going to discuss about the what? Fungal disease. Okay, fungal disease, candidiasis. Okay, candidiasis, Canidia albicans. Then symptoms attacks mouth, throat, intestinal tract and vagina. Mainly in a intestinal tract, that alimentary canal system, and then in a vagina. Then vaginal itching or soreness, abnormal vaginal discharges and pain during urination. They will feel very pain during urination, vaginal discharges and vagina. It is affecting mostly in a female. Okay, so no incubation period. Then in a protozoan infection, trichomoniasis. Trichomonas vaginalis. So vaginitis, greenish yellow vaginal discharge. ஒரு மாதிரி ஒரு fluid வந்து secrete ஆகும், வெளியில வரும். Itching and burning sensation, urethritis, epididymitis and prostatitis. This epididymitis, then prostatitis is the for what? Sexual organ of male. Okay, that region mainly cause the infection. 4 to 28 days is the incubation period of protozoan disease. Can you understand? So bacteria, virus, fungi and protozoa cause the sexually transmitted infection. This disease they can spread through what? Sexual contact or blood transfusion or infusion of needles or in a what are the things we have used. So mainly in surgical instruments. That surgical instruments also it is used. The disease they can spread from one person into another person. Okay, can you understood all of you? This diseases, name of the disease and then causative agent, symptoms and incubation period. Next now we are going to discuss about the cervical cancer. Cervical cancer is caused by a sexually transmitted virus called human papilloma virus. This is also one of the sexually transmitted infection. It is causing the cancer in the cervix Okay, so it is caused by the virus human papilloma virus. Human papilloma virus may cause abnormal growth of cervical cells or cervical dysplasia. So the cervix region la தேவையில்லாத ஒரு tissue growth abnormal நம்மளால கண்ட்ரோல் பண்ண முடியாத தேவையில்லாத ஒரு tissue excess tissue growth இருக்கும். அதான் நம்ம என்னன்னு சொல்றோம், for what cancer அப்படினு சொல்றோம். The most common symptoms and signs of cervical cancer are pelvic pain, increased vaginal discharge and abnormal vaginal bleeding. வெஜினாவில் இருந்து ப்ளீடிங் இருக்கும், தேவையில்லாத அந்த டிஸ்சார்ஜஸ் ஃப்ளூயிட் ஒயிட் கலரில் ஃப்ளூயிட் டிஸ்சார்ஜஸ் இருக்கும், அவங்களுடைய ஹிப்பில் பெல்விக் ரீஜன்ஸில் பெயின் இருக்கும். ஸோ த ரிஸ்க் ஃபேக்டர் ஆஃப் cervical cancer include having multiple sexual partners. ஸோ மெயின் ரீசன் இட் இஸ் caused by having the multiple sexual partner, prolonged use of contraceptive pills or continuously for many years they are using the contraceptive pills, that is also one of the reason to cause the cervical cancer. So cervical cancer can be diagnosed by Papani-Gallulo smear. Okay, Papani-Gallulo smear. Okay, with the help of that smear we can diagnose that cervical cancer. It is combined with the test, HPV test, one of the human papilloma virus test. That test they are doing that test also. Then that smear test, Papillo-Gallulo smear test also they are doing. And X-ray, CT scan, MRI scan and PET scan may also be used to determine the stage of the cancer. Then with the help of the X-ray, then in a scan, 3 different types of scan, CT scan, MRI scan and the PET scan. Okay, we can determine the stage, எந்த ஸ்டேஜில் அந்த கேன்சர் இருக்குன்றதை ஐடென்டிஃபை பண்ணலாம். Then the treatment options for cervical cancer include radiation therapy, okay, surgery or chemotherapy. So chemotherapy with the medicines or through the surgery remove or in a radiation, அங்கே ரேஸ் அப்ளை பண்ணி அந்த ரேடியேஷன் தெரப்பிலையும் நம்ம குணப்படுத்தலாம். Then in a modern screening techniques can detect precancerous changes in the cervix. Then nowadays number of techniques are there, screening techniques are there. With the help of that technique we can detect the cancerous any changes present in the cervix. So before forming the cancer we can screen with the help of the technique. We can for diagnosis any cancerous growth இருக்குதா வருமா அப்படின்றத நம்ம என்ன செய்யலாம், diagnosis பண்ணிக்கலாம். Then therefore screening is recommended for women above 30 years once in a year. So in medically they are giving the advice to the woman, married woman 30 years, above the 30 years they need to check in every year. Cervical cancer can be prevented with vaccination. Then with vaccination also we can prevent this disease. Primary prevention begins with human papilloma virus vaccination of girls aged 9 to 13 years. So primary அது ஏஜ் அட்டன் பண்ணுற அந்த ஸ்டேஜில் உள்ளவங்களுக்கு we can give the primary prevention of this vaccination in the age group of the girls 9 to 13 years before they become sexually active. So modifications in lifestyle can also help in preventing cervical cancer. Then நம்மளுடைய lifestyle அப்படின்றப்ப தேவையில்லாமல் unwanted medicines, then that usage of food, that number of things are there. So we need to have a modified lifestyle, healthy lifestyle also we can prevent the cervical cancer. Healthy diet, avoiding tobacco usage, preventing early marriage, practicing monogamy and regular exercise minimize the risk of cervical cancer. Okay, practicing monogamy, we should not contact with the number of multiple partners, only one partner. Okay, so like that steps we can this one they can avoid the cervical cancer. Okay, can you understood all of you what we have discussed today? Medical termination, pregnancy and then sexually transmitted diseases, then the diseases viral, bacterial, fungal, protozoan diseases, causative agents, symptoms and incubation period and cervical cancer. This we have discussed. Can you understood all of you? Do you have any doubt? Through phone anytime you will ask to me. Okay, Thank you.